Some of these services, and there's a lot of services for that matter. I mean, we're talking, it ranges from disease management to speech therapy. I want to show a list to our viewers. It's a graphic, and maybe we should start with the first one. Well, actually, this is not what I thought we were going to bring up, but tell me what this is. A little graph that kind of shows the amount of days.
Okay, right. So what this is a readmission of 30 days. And I just want to showcase here that our home care takes a lot of pride in keeping people out of the hospital. So as I mentioned before, we want to prevent a hospitalization, but when they're coming from a hospital, we definitely want to prevent a rehospitalization. So there are penalties when patients go back into a hospital within 30 days, and we want to make sure that nobody wants to go back, right? You want to be in the comfort of your home. You want to avoid that hospitalization. There are infections that occur when people are in the hospital, nosocomial infections, those are called. People don't want to be there. They prefer to be treated at home. So we're under the national and state level of readmission rates. So that's another reason why you would choose Baptist Home Care when you have 500 to choose from. You want to see what their readmission rate is. If an agency's readmission rate is above the national, then you know that they're not going to provide good quality care for you.
Exactly, because they're putting you back exactly where you didn't want to go in the first place. And I'm sure patients, Anna, appreciate that. The fact that they can stay home, they've got someone coming in, and they feel, you know, there's no guarantees.
Absolutely, and a big part of that is that coordination with the doctor and that open line of communication. So if there's any issues during their care, we can mitigate that and, you know, have them be seen sooner, or change a medication. There's a lot of things that we can do in the home. If we see any signs or symptoms of an infection, we're taking care of that as well. So we're doing a lot of steps to prevent that readmission. Our readmission rate compared to the national is significantly lower. So we're about at a 9%, and the national's at 24%.